Good morning, everyone, and welcome to the Dare County Board of Commissioners special called meeting this Tuesday, June the 28th, 2022. I'd like to call on Commissioner Couch for an invocation.
Be my pleasure. Let's bow our heads and seek peace and unity. Gracious, loving Creator, we are grateful to be here as a community and as a community of family, as a community of friends, motivated by love, motivated by caring. And we just thank you, Heavenly Father, for all your many blessings. Thank you for the compassion that health care generates. Thank you for the good health, wellness that good health generates. And we thank you for capable, caring people who want to make a difference. Amen.
Thank you, Commissioner Couch. May we stand for the pledge? I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all. Someone have their phone on? All right, folks. You have an agenda out there, and the second item on the agenda is opening remarks by myself, and I will certainly ask you folks to indulge me for quite a few minutes before we move to item 3. So my fellow commissioners, I need a pass today rather than my former other meetings that I had where y'all give me a hard time about spending so much time. So,
It's a gift.
So
It's all such a thing.
Before I start, I would like to say I recognize some distinguished guests in the audience with us today. We have with us the mayor of Manteo, Mr. Bobby Owens. We have also with us Miss Betty Selby, who is the mayor pro tem. We have Commissioners Todd Klossel is with us, and we also have Commissioner Sherry Winston. And we also have their town manager, Miss Melissa Dickerson. Please know, board, that we can't thank you enough for being here. I will reiterate that this board is 100% behind our Board of Commissioners in Manteo to assist them in whatever way we possibly can to remedy this situation that we have concerning services in Manteo for health care. In addition, this morning we have with us Mr. Tim Sheridan, who chairs our Health and Human Services Board. He also has several of his board members here today. Ashley Jackson, Alan Moran's on that board, and Vice Chairman Overman sits on that board. Thank you all for being here this morning. We also have with us this morning Mr. Terry Wheeler, who's former county manager of the county here. I'm sure Terry is tickled to death. He ain't got to deal with this situation, county manager. We also have Mr. Bill Massey, who's the former chair of the Lost Colony Rehab. Thank all of you for being here this morning. And certainly, last but certainly not least, I am honored to have with us this morning Representative Ronnie Sloan, President of the Outer Banks Hospital, Ms. Tess Judge, Chair of the Outer Banks Hospital, and Mr. Jay Briley. Jay, thank you for traveling here, all the way here this morning from Greenville. We certainly appreciate your time for being here today. If you folks will allow me, because I think it's very important that we get this message out to our community, not only the citizens of Manteo, but everyone here today, so that we can certainly set the record straight and know what's taken place with respect to the issues that we've had concerning health care on Roanoke Island. Why this special meeting? We felt like it, our board felt like that we needed to call this meeting so that we could set the record straight of what's taken place up until this date. Also take a look at issues throughout the community and all the feedback that we've been getting from this, so that we could listen to the public this morning, listen to our folks from Vidant, listen to our individual commissioners. Because my objective today is, after we hear from everyone, that our board try to work with the existing system and our fellow commissioners in Manteo to try to look at options and help in any way we can to mitigate this issue moving forward, so that we can do this sooner rather than later. The first thing that occurred back on May the 23rd was a letter that was written to our citizens from Ms. Lynn Mills, who is the Regional Administrator of Operations at the Outer Banks Medical Group. And those of you sitting in the audience today, I'm sure a number of you have received that letter, as well as several of my fellow commissioners here. The letter said that on June the 23rd, 2022, the temporary contracted providers of Outer Banks Family Medicine, Manteo, will no longer be provided care at this facility. The letter went on to say that Manteo will no longer be available to provide your medical care. The Outer Banks Medical Group does not currently have primary care providers accepting new patients. Ask that you consider all alternative care options available to you, including, and they provided this information, currently locations that were accepting new patients. And to receive a copy of their medical records, you needed to contact their office and complete a medical release form. They were highly optimistic, as the letter went on to say, that we will be able to hire at least one new provider in late summer or early fall. Now, that letter went out on May the 23rd to individuals, quite a few individuals in Manteo. After that letter went out, needless to say, our phones started ringing. We started hearing from citizens in the community that received this letter. We received phone calls, we received text messages, we received emails. So I started having conversations with Mr. Ronnie Sloan, president of Outer Banks Hospital. And Ronnie and I have had numerous calls to one another concerning why the services were no longer available and what steps were being taken to provide services and long-term objectives. Ronnie could not be more available. In the last week and a half, we have spoken daily numerous times, even over Father's Day weekend. When he was out of town, he returned my phone calls immediately, and we've been in constant contact daily, numerous times each day. He could not have been more receptive, more responsive. And same goes with Ms. Tess Judge, who is chair of the Outer Banks Hospital. We played phone tag a couple of times, but every single time she returned my phone call as quickly as possible. And once again, we shared the concerns, she shared the concerns, and we had multiple conversations. I asked Ronnie at that time, I said, Ronnie, I'd like to reach out to your leadership in Greenville and see if we can set up a meeting so that they could come and visit with us and answer some questions and how we can remedy this situation. And out of respect for Ronnie, Ronnie said, Chairman Woodard, would you give me the opportunity to talk with my folks? We've got a lot going on. We've got a lot of answers that we can help folks with, but give me that courtesy. And I said, absolutely. I have no problem with that. I can't express, once again, my appreciation enough to Chairman Judge and President Sloan for our conversations that we had. Ronnie went to work immediately, talking to his folks in Greenville. On June the 22nd, I received a text, I received a phone call, I received an email, and I received a letter from President Sloan with respects to the concerns. And in this letter, he stated, and I won't read the entire letter, I'll share pieces of it. He thanked me for my continued dialogue and insight. And he said, note that these issues will be major topic of discussion at this week's Outer Banks Hospital Board of Directors meeting. That was scheduled for Friday, June the 24th at 10 a.m. This meeting is open to the public during open session. There is, however, no public comment period required as part of these meetings. And I have to say to them that we're still in, I believe, the orange mode. They couldn't meet one-on-one together, so that's why they held the meeting virtually. He said, we will attempt to address these questions at this meeting. We intend to focus the bulk of the meeting on explaining the current reality facing healthcare, how this reality is impacting us locally, and our efforts to recruit and retain providers in our community. He said he will answer many of the questions that those in the community share, and he said he certainly welcomed the opportunity to meet in small groups to continue the dialogue and the conversation. So I immediately reached out to Ronnie and said, Ronnie, thank you for this letter. I did express my concern to Ronnie that this was certainly not the way that to handle this. And I explained to him that I would be sending a letter to Dr. Michael Waldron, who is Vidant Health CEO. I don't know if that letter circulated in the community or not, but if you will humor me, I would like to share that with you. I said, Dr. Waldron, I'm reaching out to you as chairman of the Dare County Board of Commissioners and a concerned citizen of Dare County concerning the health care of our citizens in Manteo, North Carolina, that effective June the 23rd, 22, the temporary contracted provider at Outer Banks Family Medicine will no longer be providing care at this facility per Lynn Mills Regional Administrative Operations, Outer Banks Medical Group. I understand Outer Banks Family Medicine, Manteo, will no longer be available to provide medical care for the residents of Manteo, and that the Outer Banks Medical Group does not currently have primary care providers accepting new patients and asking that residents consider alternative care options. I am aware the Outer Banks Medical Group has and will continue to recruit primary care providers to fill the vacancies at Outer Banks Family Medicine, and that they are committed to provide access to virtual health care services on the Outer Banks. With that said, Ms. Lynn Mills, Regional Administrator Operations, Outer Banks Medical Group letter that was sent out on May the 23rd, 2022 to residents in Manteo, referencing the above, there has been quite a bit of concern by those affected. The Dare County Board of Commissioners are being approached daily by the residents of Manteo expressing their concern and what can be done to provide medical services. I recently reached out to Ronnie Sloan, president of Outer Banks Hospital, and Ms. Judge, chairman of the hospital board, to see if they along with yourself and others, would be willing to meet with the Dare County Board of Commissioners, Manteo Board of Commissioners, and residents in a special call meeting to address the current situation and provide an update on plans moving forward to remedy the lack of providers and medical services. Ronnie Sloan and Tess Judge were gracious enough to see that they could accommodate my request. I received a text message, phone call, email, and a copy of the letter that was sent to my attention from Ronnie Sloan last evening, Wednesday the 22nd, thanking me for our continued dialogue and insight as we navigate this complex time in healthcare. Ronnie and Tess know that healthcare, specifically primary care in Dare County, is critical to our community. I was made aware of the phone call and the letter that was attached to the email that was sent. The health care issues in Manteo would be a major topic of discussion at the Outer Banks Hospital Board of Directors meeting on Friday, May the 24th at 10 a.m. during their virtual meeting. I was also made aware that both ECU Health and Outer Banks Hospital leadership have a good sense of the concerns by the citizens affected, and that the board would attempt to address those concerns at their meeting. I was also made aware that the bulk of the meeting would explain the current reality facing healthcare. However, reality is impacting us locally, and their efforts to recruit and retain providers for our community. After receiving this information from Ronnie Sloan last evening, I was very disappointed to learn that the leadership team in Vidant Health was unwilling to meet with us in a special call meeting to address the current health concerns and a plan moving forward, but rather chose to address this at a virtual board of directors meeting of the Outer Banks Hospital, where even though the public had an opportunity to participate in virtual meetings, there would be no public comment period allowed. This is totally unacceptable and shows a lack of transparency on Vidant Health leadership. Please know that I run a positive, upbeat County Board of Commissioners meeting for our citizens of Dare, and this would have been a perfect opportunity for the leadership of Vidant to address our Board of Commissioners, Manteo commissioners, and our citizens to address this up front in a public in all that has happened in recent weeks and the steps that were being taken to recruit and retain providers in our community. In all due respect, Mr. Waldron, Dorothy corrected me on this, and I was a little more upbeat, but in my original letter I said shame on the leadership of Vidant, but she corrected that, so I was a little less harsh on Dr. Waldron at the time. So I sent that letter to Dr. Waldron. I, along with a number of my fellow commissioners, tuned in to that meeting virtually. And Ronnie Sloan, president of Outer Banks Hospital, had a PowerPoint presentation that he made to his board. And it did address quite a bit of the issues that we were facing. And at this time, I'm going to ask our IT, Matt, to play, bear with us. This is about 20 minutes, folks, but bear with us. It's some really good information in Mr. Sloan's presentation. So I'm going to ask our IT to share that with you now.
The volume has moved us to our next tier, which is orange, and we can't meet in person until we see lower numbers again. I truly hope we can be together again in person very, very soon. I prepared a special report for you today related to family medicine Manteo and the access to primary care issues that you're well aware of and that continue to impact our community. We've been in close contact in recent weeks, and I thank you all for your leadership in this space. This information was developed with the questions we have received in mind. These questions are coming from patients who've been directly impacted, concerned citizens, other community leaders, I know you're also getting phone calls, and I appreciate you helping our community understand the challenges we're facing, as well as the work we're doing to restore and even expand care. First and foremost, I know you each share my deep concern about the lack of access to primary care. I know we also join in feeling deep empathy for the patients who've been directly impacted and who rightfully feel concerned about their ability to receive care. The information I'm about to share is to communicate true information about why we are in this situation, what we've been doing to try to avoid it, and what we will continue to do to recover in the long term. I know that despite the facts, many in our community are without access to primary care, and our friends in Manteo are hurt and angry. I acknowledge these also as facts, and I share their concern about the state of primary care close to home. Let's talk about the letter. Believe me when I say that no one at the Outer Banks Hospital and Medical Group wanted to draft, print, or mail the letter. We, myself and staff, did everything humanly possible to avoid having to send it because we knew how it would impact the patients receiving the news. But in the end, we just simply had no choice. Hiring temporary providers to provide care at Manteo Family Medicine was a stopgap measure to get us through until we could find a permanent replacement, something we've been persistently working on. When we learned that the temporary providers were not renewing their contracts, we were required by law to let the patients that they were caring for know that we could no longer provide their care. The law states that we have to give 30 days notice to patients when we can no longer provide care to patients. I provide the link to the North Carolina Medical Board rules that govern this so that you can have this information as a resource. Unfortunately, we had no choice but to send the letter. I want to share more about how we're assisting patients with care. The letter was mailed to 2,418 patients. And one thing I do wish we had done differently was to place the dedicated phone number higher in the letter so that patients saw it in plain view. We did provide a dedicated number for patients to call for medication refill assistance. Patients are calling daily, and we've helped hundreds of patients with medication refills. A clinical team from ECU Health is also helping more than 150 patients with complex needs. As you know, healthcare is a highly regulated industry, and unfortunately, we're only legally able to continue to provide medication refill assistance for a period of 30 days. It's worth mentioning here because our ability to help is legally limited. Out of desperation, which I understand, patients are asking why we can't move them to another provider in a clinic or system. I truly wish we could. It's just that all of our other doctors have full patient panels and cannot humanly take on new patients. It's just the reality of the situation. I can only imagine how it felt to receive this letter. I have an elderly father who is disabled with many chronic conditions. If he received this letter, I would have been devastated as well. People are asking why a list of primary care practices was included in the letter. To receive a list of other providers in Elizabeth City, Edenton, and Chesapeake must feel like a punch in the gut. I assure you and all the patients who received this letter, we're only trying to help. As a matter of normal operations, we maintain a list of all regional primary care providers taking patients, so we can provide this information when people call and we can't take them on as a patient. Even if we don't have access or the ability to provide your care, we want you to have care. But I have empathy with how that may feel to a person receiving this letter. Now, I don't have a doctor and you want me to travel an hour. I'm so very sorry that this is currently our reality. And I wish we could quickly hire more temporary providers to replace the two that left until permanent providers are secured. The reality is, it is getting just as tough and competitive now to hire temporary providers as it is to hire permanent providers, even advanced practice providers. Even if one were available, it would take up to 90 days to legally bring them here. I wanted to talk about the letter first and provide some answers because the letter and how receiving made people feel is important. We are compassionate people and we do care. I can't say it enough. No one in healthcare ever wants to send a letter like that. We are in the business of helping people. Now I want to clear up any concerns that we're closing the Manteo practice. We are not. In fact, for several years, we worked with the College of Albemarle to find a location on the Manteo campus to add healthcare services there. In the end, the location just didn't pan out. Now we're currently in conversations with other individuals with a plan to accommodate more primary care providers in the long term in Manteo with a larger site that will serve Roanoke Island well into the future. The best news I have to share today is that we have one physician under contract arriving late to mid-July of just this next month to practice at family medicine in Manteo. We began recruiting this physician in the summer of 21. In fact, we had our first recruiting conversation with this provider in August of 21, nearly 11 months ago. Recruiting providers is a marathon and not a sprint. We are not closing Manteo, and we mean it when we say we are committed to reopening access to those who have lost it. And we have a plan for those 2,418 patients who may want to come back to Manteo Family Medicine. This has been a top concern by the patients who received the letter. They have the right to ask, will they be the first to become patients again? Granted, it won't happen overnight. However, we'll be mailing another letter to those 2,418 patients who received the first letter. This letter will provide information about getting on a wait list to rejoin the practice. Once our new physician is here and the scheduling template is ready, we'll begin plugging patients into care using that wait list. So why are we in this pinch? Who's to blame? Why are doctors leaving? It's a human response I get. We looked at the history of physician turnover since 2017. It revealed that several have retired after a long career, several have made the change from primary care to urgent care, and several left the area to move closer to family and loved ones. We lost 7 providers when another healthcare system closed practices in Manteo and Kitty Hawk, and several non-hospital practices closed in the area. The reality you all know because we have been talking about it, and that's burnout. The pandemic took a toll on people, healthcare workers included. People are also asking, why is it so hard to recruit providers? I mean, come on, this is the Outer Banks. We live in the most beautiful place on earth. I have to say, we're not alone. It's just not about the housing crisis, although the lack of inventory and the prices are hurting us in recruitment. Primary care specialties of family medicine, internal medicine, and hospital medicine physicians are the most sought out after, yet lowest paid, making them the hardest positions to fill locally. As a matter of fact, there are currently over 3,800 openings for family medicine in North Carolina alone. In a recent presentation at the Conference for Physician Recruiters in the Carolinas, data revealed this year's graduating primary care residence class had an average of 90 viable job openings to consider in their respective markets. Locally, physician candidates have turned down offers because of the small selection of available housing, the high cost of living, or they'd prefer to live in a more metropolitan area. Although we dearly love it here, it's not always for everyone. We see that from a geographical standpoint as well as a clinical standpoint. Healthcare workers here are truly special because most are what we would call generalists. We have to do more with less. The primary care physician has to be a primary care doctor, a behavioral health clinician, a pulmonologist, a neurologist, and so on. This is not unique to other rural areas in America. In larger cities, those specialties are plentiful. Not everyone we interview wants to work in a small, rural, clinical environment is another reality that we are up against. So why can't doctors just open their own practice on the Outer Banks? Well, those who do, whether they want to work for us directly or not, we always try to help. We've assisted several practices outside of our medical group when they have requested it. For instance, we helped Beach Medical find a new home when they had to leave Kitty Hawk years ago. We recently received a call from a practice interested in coming here, and we connected those primary care providers with a local realtor that we knew who already had some medical space available. The reality is that the current housing shortage and healthcare provider shortage makes opening a new practice extremely difficult. Independent practices are also harder and harder to operate due to reimbursement models from Medicare and Medicaid. This is why you have seen some practices in our area stop seeing those patients. We are truly the safety net for our community, regardless of the ability to pay. What about the ones we are able to hire? Can't we pay them more? I keep hearing. We do our very best to set pay as close to fair market value as we can. Stark law prevents from exceeding fair market value. The law is in place so that we can't otherwise incentivize physicians to send referrals to us, which means they can practice medicine and send their patients where they believe they'll receive the best care. We believe that patients have the right to choose where they go. Stark law helps maintain ethical practice so that patient rights are protected. We've also been asked about what we're doing to help with housing. A lot of your board members know, but just as a refresher, Outer Banks Hospital maintains 12 properties currently that we use for temporary housing for providers and other medical healthcare workers. I want this board to know how much this community has stepped up to let us know about available rentals for our team members. Several of our team members have been helped through the generosity of local residents. I'm also working actively and have been for the better part of a year with developers in Manteo, Nags Head, Codeva Hills, and Kitty Hawk to acquire additional workforce housing for provider recruitment and other healthcare workers. You may also be hearing concerns about us building a cancer center and relocating the urgent care center in Nags Head. We've had the question come up a few times. I know primary care access is a top concern, but so is cancer care. In fact, cancer is the #1 cause of death in both North Carolina and Dare County, and planning for our new cancer center has been in place since 2016. Our community has stepped up to fund a large portion of the project. I am so thankful to our donors who are helping us make a difference for people with cancer in our community. We broke ground on the new cancer center on June 16th, and it was shared that we've reduced the 5-year mortality rate from cancer center by 25% here in Dare County. Prior to 2014, our death rate was higher than the state rate, and that is no longer the case. For these reasons, I know I have your support to continue this work. And because we were outgrowing the old urgent care facility and needed land to expand cancer care for our community, it just made sense to relocate our urgent care center. On the primary care front, the new urgent care building also houses a family medicine practice, and we are currently recruiting family medicine providers for that location as well. Winding down here towards the end of the presentation, I want to clearly communicate that we've been extensively recruiting for primary care physician for 10 years. The data just since 2018 is here, and we've seen 44 candidates presented to our different hiring services lines from the hospital or from the ambulatory medicine world. 9 of those were eliminated for consideration. We do extensive background checks. We look at quality, standards of care. We only want the best providers to take care of our community that we live, work, and play in. 35 candidates have gone through the entire interview process. 14 of those candidates have decided that they were interested in proceeding after the offer was made. And the main reasons, as we've mentioned some, is housing, cost of living, and scope of services and local amenities. 6 candidates have accepted offers, some of those verbally, and some now have signed their offers. 2 primary care physicians, 2 hospitalist advanced practice providers, 1 oncology advanced practice provider, and 1 urgent care advanced practice provider. Excuse me. 10 candidates are outstanding with different levels of engagement, and we currently have 2 offers pending for 2 additional family medicine physicians and are hoping to hear back very soon about their acceptance. Any new permanent provider who comes in over the next 3 to 6 months, we've been actively recruiting since well back into 2021. At the risk of sounding a little defensive, we are not asleep at the wheel, and we did not just wake up. I know you all know this, but I just had to say it. The national primary care struggle is real, and it has hit home. I think the ad campaign that we released in January of this year really illustrates our efforts to market the opportunity to come to practice medicine in a beautiful, small coastal town environment. There were others, but this one in particular featured Roanoke Island and was sent to nearly 25,000 primary care physicians as a recruitment tool. I'd be remiss not to mention the ingenuity, flexibility, and can-do attitude of our local team members and our partners who've been working so hard to help. We're constantly evaluating and adjusting to meet the needs of our patients. These are just a few examples. We utilize locum physicians and staff, or we may call them travelers when possible, to fill gaps throughout all of our service lines in and outside of the hospital. From fiscal year 20 through fiscal year 21, 8 months of our fiscal year, we've seen provider costs increase 79%. And team member costs, nurses, MRI technologists, lab technologists, and others, 522%. Or for the first 8 months of this year versus last fiscal year, we spent $1.6 million last year. We've so far this year spent $4.7 million just for these temporary providers and team members. We're utilizing Vidant now, which is our virtual platform, to help with refills, as well as our urgent care centers and our Center for Healthy Living. Chesapeake Regional Medical Group has stepped up and is assisting with referrals and accepting patients. We're also working with a couple of national organizations, Premier and the Advisory Board, and with ECU and ECU Health, to look at additional new innovative models for primary care, including telehealth and advanced practice providers and others, so we can open up as many services as we can locally. So in summary, I'd like to reiterate that we're deeply sorry about the situation at Manteo Family Medicine, and we're working diligently to restore and ideally expand care. There has been ongoing persistent physician recruitment since 2018, and although I've not said much today about the impact of COVID-19, the pandemic impeded every industry, including healthcare. According to a Becker's Hospital Review white paper, the American Medical Association recently cited that 1 in 5 physicians and 2 in 5 nurses intend to leave practice in the next 2 years. With the help of our partners, our civic leaders, and the community, we will create solutions that increase access to primary care. It'll take a partnership and it will take time.
Thank you, Ronnie, for allowing us to share that presentation with the public today and our board. I want to follow up with my letter to Dr. Waldron. Jay Briley, President, ECU Health Community Hospitals, was gracious enough to respond to me the very next day with my letter. And he writes, "Dear Chairman Woodard, I'm writing you on behalf of ECU Health Chief Executive Officer, Dr. Michael Waldron. Thank you for your letter dated June 23rd with a formal invitation to attend the special call meeting between the Dare County Board of Commissioners and the Town of Manteo Board of Commissioners scheduled for Tuesday, June 28th at 10:30 a.m. I appreciate your continued dialogue with Ronnie Sloan, test judge, and the leadership of the Outer Banks Hospital as we navigate this difficult and unprecedented time in healthcare. I was pleased to see a number of commissioners and community members on the recent Outer Banks Hospital Board of Directors meeting, and I hope the information presented helped clarify any misconceptions about the recent developments in Manteo, as well as reaffirm our commitment to transparently solving the primary care challenge in Dare County. I understand the purpose of Tuesday's special call meeting is to discuss the current state of primary care on Roanoke Island. I know the Board of Commissioners for both the county and town are working diligently to help solve the complex issues in healthcare impacting members of the community. Please know that I fully intend to attend the meeting to listen to the discussions between the commissioners and hear comments from the public. We will use those comments to further our efforts. In my response to the letter to Mrs. Dickerson, Manteo Town Manager, I expressed our commitment to meeting with community leaders in small group settings as needed where we could further the conversation around this important topic. And I would like to reiterate that commitment in this letter and express my willingness to help facilitate follow-up conversations where productive discussions can continue. Thank you again for your continued dialogue with the Outer Banks Hospital, ECU Health. I know we're all committed to doing what's in the best for those we are proud to serve. Please do not hesitate to reach out with any questions. And Jay, thank you for that letter. Very much appreciated for you responding to me. And it absolutely did answer Ronnie's presentation, quite a few concerns that I had and questions that I had, quite frankly. That very same day, we were fortunate that the hospital board went into closed session. That way we were able to leave that meeting and come over here to Manteo at 11 o'clock. I want to thank the mayor and town manager, Ms. Dickerson, for setting this meeting up with their board of commissioners at 11 o'clock that morning to host a meeting that was a presentation for that board that improve access to care and health for all North Carolinians. And that was a community practitioner program that was presented to us. And it was very, very informative session. I know that Commissioner Bateman attended that with me, and I know several of our other commissioners, Commissioner House did this virtually. So thank you, Mayor and Town Manager, for doing that. I know we need to follow up on that and where we go from here with that, but I know that's certainly one of the options for our citizens of Manteo. I want to reiterate at this point in time, once again, I stated early on that our commissioners, Dare County Board of Commissioners, are committed 100% to support our Manteo Board of Commissioners with their efforts and issues facing health care on Roanoke Island. And we'll do whatever we need to do in order to assist with that. I will say that with all that's been said to date, I am cautiously optimistic, encouraged by what President Sloan said in his PowerPoint presentation. It's some good information. I certainly hope that quite a bit of that comes to fruition sooner rather than later. But we all need to just step back a moment and put your thoughts in check and get rid of the anger and get rid of the angst, and let's work together as a Board of Commissioners, Dare County, a Board of Commissioners as Town of Manteo, with our Vidant partners and anybody else out there, that we need to really be proactive and positive, and let's come up with some solutions and some help to help our folks that provide these services. You know, you can get a heck of a lot more accomplished, folks, with being proactive, working together, than you can just pounding your fist on the table and trying to beat somebody up. I would, however, be remiss if I didn't point out that the timing of the letter that was sent out to the public by Ms. Miles was a little disappointing. I think it could have been handled. I feel like that they saw this coming. I think it could have been handled much easier way, informative way than out of the blue in 30 days' notice. I'm just going to be that frank. And then the second concern I have, and I'd be remiss if I didn't point out, that why did it take from May the 23rd until June the 24th to address these concerns in a PowerPoint presentation at an Outer Banks board meeting? Could have got a whole lot more done if this been done publicly in Manteo before our board and stuff. But past is past. Let's move on. Let's work together. Let's try to work things out and complement one another. There's much more that I would personally like to say, but in the interest of time today, I will move on to item 3 on our agenda, and that's remarks from various stakeholders. And I'd like to offer at this time an opportunity for Mayor Owens. Would you like to make any comments this morning? Pardon? Come on up here. Come on up here and jump on that microphone in front of us. Once again, thank you for you and your board for being here, Mayor. It's most appreciated.
Commissioner Woodard and the board, on behalf of the Tiny Manteo board, I'd like to say thank you for the efforts that you're putting forward in this. You caught me off guard. I didn't know what to say. So I'm going to say what I think. We need to put all the animosities, the hard feelings, the thoughts aside. We need to work toward a common goal, and that's the betterment of the health care services of our county and our town. I agree with you on everything you said about, I think the letter was a little offensive. I think it came too fast without us knowing what was going on and what was happening. I personally have attended 3 meetings in 3 days in regards to health care services, all informative. I first want to say I thank Mr. Sloan for his efforts and what's going on. We have to keep in mind, I'm going to say it, I shouldn't maybe, Mr. Sloan has bosses too. He works for a corporation, a very big corporation, and he is told what to do even though he's president of this hospital, which we're very proud of. The hospital has a bold and big reputation in this area. It's only 20 years old, done a lot of marvelous things. It's making a lot of money for Vidant. You all know that. At one time, I served as president of the board for 4 years, 2 years for Chesapeake, 2 years for Pitt, 6 years on the big board in Vidant. So I'm a little bit aware of what's going on. And believe you me, more than anything else, this is about corporate structure. It's not about the small person or the patient. We just want health care services for our community, and we got to try to put everything aside and start working toward a goal. And I am very, very confident after the meeting last night that we're headed in the right direction, fast. And with the efforts of your board and our board and other boards, we keep saying Manteo. Manteo is a very small town, you know, but when we say Manteo, we incorporate Roanoke Island. And we forget that, but it's still ours, and it's us. And we should keep it that way. So I'm just going to say, let's just keep going like we are. I feel very good. I feel very confident. I feel like we're getting there sooner than later. And I believe that Vidant, along with other structures, will come in and help us out in we'll move forward rapidly. Thank you.
Thank you so much, Mayor. I appreciate you. I'd like to reach out to Ms. Judge if she would like to make a few comments this morning.
Thank you, Mr. Chairman and Commissioners, and thank everybody who's here today. I'm here today as board chair, but most importantly, I'm here today as a Dare County citizen as well. We all are concerned and understand the situation that we're in, and I can assure all of you that we're working very, very hard in trying to recruit. We all know, as we saw on the presentation, that the labor shortage, not only has it hurt our community, but it also has impacted health care, not only in Dare County, but in the state and in the country. We're working very, very hard to recruit. I personally have been on the phone with physicians as well, talking about Dare County, and I can assure all of you today that are in this room that restoring primary care on Roanoke Island and also throughout our community is the #1 priority that I have as board chair and the Outer Banks Hospital. I will tell you this, and you've kind of touched on this a little bit, Chairman Woodard. This gentleman over here that sat behind this desk for 16 years always said, we are all one Dare County. We are still all one Dare County, and we will all work together, I know, to meet every challenge that we have. And I appreciate you, Chairman Woodard, you gentlemen, the commissioners, because I know you all are just as committed in your support of this county and all our needs. Thank you all so much.
Thank you so much, Tess, and I really appreciate you being here this morning. Mr. Sloan, would you like to make a few comments as well?
Yeah, I appreciate it. Thank you, Mr. Chairman, for playing my presentations another day and also giving an opportunity to chat just a few seconds here today. You know, I'm a little old-fashioned and listened to my grandmother a lot as I was growing up, and you know, she always talked about, you know, tigers not changing their stripes, and you know, the best predictor of the future is past history. And I really would hope that this isolated situation, that it's unfortunate that, as I said in my presentation, I'll say here live, that I have the most empathy. These are my friends. Also, as you know, I live here in Manteo, also my neighbors. And obviously, if it was unavoidable, there's no way this would have taken place. But I would ask that the community as a whole take a look at what the Outer Banks Hospital has done in the last 11 years plus since I've been here. You know, we started this cancer service line about 11 years ago, and you heard in the presentation about the mortality decrease that we've seen and the great ability to care for patients. We saw about 1,200 patients our first year in cancer services, and last year we saw almost 15,000 visits in that service line. I mean, we're keeping people here locally, and we're impacting cancer and decreasing mortality. Our board stepped up very early in 2012, 2013, and saved Alliance Imaging when they decided to leave the community and purchase that radiation therapy center so we could continue to grow cancer services and not have our community driving hours both ways just for 5-day-a-week cancer treatment, for example. You know, we opened up 2 urgent cares over the last several years and expanded one of those when another urgent care in the community left. Also, when another person in the community left and took 3D mammo with them away, and we had 2,000 to 3,000 mammos a year that could not be done in this county, our development council helped raise funds to purchase another 3D mammo machine, so we were able to continue to keep ladies and gentlemen to have mammograms here locally. Obviously, we also have a free mammo program, as a lot of you know, as well as free lung screening programs and colon screening programs for patients to prevent cancers being found in late stages. We were able to open up our first health coach in the community and drive along this beautiful community we live in, including over on the island of Ocracoke, do freeness welding screenings, you know, free cancer screenings, and connecting people with primary care who didn't otherwise have services. We continue to grow our services and our outpatient rehab building to be able to continue to have more occupational therapy, speech therapy, and other physical therapy services as well. We've added a new operating room in the last number of years as well to continue to be able to keep folks locally and keep surgical services locally as well. We were able to step in and pick up the cardiopulmonary rehab program that was in Kitty Hawk to keep that service also from going away from our community and keeping our patients close. We were able to bring ear, nose, and throat services into the community, urological services into the community, and have continued to grow our North Campus as needs has persisted, and growth in both permanent residents as well as tourists, obviously, that we all know in this unprecedented growth. We also opened one of the few COVID testing centers very quickly during the crisis of COVID. And again, as we mentioned in the presentation, we are indeed a safety net. You know, the only organization in the Outer Banks that takes people regardless of ability to pay, whether that's in the hospital, whether that's in our physician practices, or our urgent care centers. So again, I do just hope the community takes a look at our heart, at my heart personally, at what we've done for this community, how much we care about this community. And trust me, if we could not be in a situation, if I had any power to do that, I would be there. But I'm very confident we'll get out of the situation very soon. Thank you for the opportunity to have comments.
Thank you so much, Ronnie. I appreciate you, your comments, and I certainly appreciate you being here today. Mr. Briley, would you like to speak with us, if you would, please? Thank you once again for your letter, and thank you for being here with us today as promised.
Well, thank you, Mr. Chairman, for the invitation and for creating a forum for us to have some dialogue around this. I won't repeat so many of the important and great comments that folks have made, including from you and certainly from Ronnie as well. So, thank you for having us here today. And as I said in my letter, sincerely appreciate the continued dialogue that you specifically have had with Ronnie and with Ms. Judge and leaders across the hospital. We do certainly share across ECU Health the level of angst and understand, the concerns that folks have around access to care. It is a challenge. In my role, I work with communities all across our region, and it is a significant challenge that we face regionally, statewide, and more in all kind of corners of the nation. And so we're deeply concerned about that, but also balance that with a sincere and deep level of optimism about how we move forward together. We're confident in our ability to close this gap. ECU Health, as we're now known, and Outer Banks Hospital, needless to say, served this community for more than 20 years now, and throughout that time have invested a tremendous amount, including a tremendous amount of love and caring, to the key theme from the invocation today that resonates with all of us. Our focus really is on providing quality care and access to care, and so we stay committed to that as we serve to look forward to meeting our mission. Looking ahead, we recognize these challenging times, but we're confident that we have the right leaders in place, and that the leadership group, just are staunch advocates for this community as they connect with folks across ECU Health and certainly across the state for what's going so right here in Dare County. It will take some time, as Ronnie mentioned, to fully restore, but we're optimistic about being able to do that. And in the meantime, the things that we would, ask for, all of our elected officials would to be continue to create these environments so that we have a common understanding about the challenges we face and the steps ahead, to continue to work collaboratively on solutions for the housing issue, or really sincerely appreciative of the significant progress that this group is making in that regard. That will certainly help, not only on the physician front, but other challenges we have with healthcare professionals coming into this community that are so critical. So thank you for your continued collaboration, and the teamwork approach that you have for us in this challenge. Thank you.
Thank you again, Mr. Briley. I really appreciate you being here and your comments and showing that you care what's going on in Dare County. That brings us to item 4 on the agenda, and that's public comment. And I would ask the county manager if he would handle that.
Good morning, everybody. Now's the time that's been set aside for public comment. If you have public comment, some of you have signed up. If you've not signed up, when you raise your hand, I'll recognize you when we go through this list. If you please come, state your name and where you're from. We normally have a 5-minute time slot. There's a lot of people here, and I'm not sure if everybody wants to talk, so we need to make sure we're courteous of our time. There's a green light that will come on when your time begins. There's a yellow light that will come on when there's about a minute left. and when the red light comes on, you need to conclude your remarks. With that said, I will go down the list. The first person is Bree Sansota.
Welcome this morning.
Good, welcome. I'm Bree Sansota. Good morning, Chairman Woodward and Board of Commissioners and ECU health officials. The only thing that I had to say, today is the first time I heard in your letter about there being a waiting list. I was told by everyone at Family Medicine that we could not automatically be reinstated once you finally did achieve medical care, like the primary doctor or the PAs. And I think that's unfair. I think those of us that were dropped should automatically be reinstated when you get new health care. That's what I have to say. Thank you.
Thank you so much.
Next is Randy Finiger.
Mr. Finiger, welcome this morning.
Thank you, Mr. Chairman. I went to law school so I could learn to talk 6 minutes in 5, but I will do my best. Randy Finiger, I'm a resident of Manteo. I am one of the 2,400 plus who got fired. I've never been fired from medical practice, so it was kind of a unique experience. And I've now traded a 10-minute drive for an hour drive in order to have primary care. I appreciate the facts that have come out at this discussion. I wish many of those facts had been discussed or reported to the 2,400 plus and their families and other affected parties long ago. I would make a couple of observations. Let me echo the comment of the previous speaker. I want an assurance as a former patient of this practice that when the wait list opens, the people who were fired are the priority, not somebody else. I have not heard that assurance. I think that still got 3 minutes, good. I think we all realize that this is not only an issue for Manteo and residents of Roanoke Island, but clearly pushing 2,400 patients out into Dare County, or I'm in Currituck County now, I guess, so I don't think I have to pay taxes there. I hope not, paying enough here. Means that this is a much broader problem than just our local town, Roanoke Island, and even Dare County. This is causing, because every medical practice I called in order to find a place to go said, we're overwhelmed with calls, we'll get back to you. Now, fortunately, somebody did. So I am lined up if I don't mind a 2-hour round trip. One thing that I will close with this, if you believe that, I have not heard, and perhaps I've missed this, about formalizing a role for the community and hospital representatives, corporate representatives, other governmental representatives, perhaps public health, perhaps representatives from here. This affects all of us. You have said that, Mr. Chairman, most eloquently. I would ask that a commission of citizens who are affected, not only the ones of us who were pushed out, but who will be affected by decisions going forward as they relate to healthcare in this county and this community. I think that the interest of the community is apparent by your audience. There are many people in this room who could contribute in an ongoing way, in a formal structure that would take all of the elements, so we wouldn't have to come to a meeting, you wouldn't have to hold a special meeting. We would be hearing from each other on a regular basis, working collaboratively with all elements to try to find the best solutions, the most creative solutions. There's a lot of creativity in healthcare, trying to address issues that have been raised here. Let's make sure that we're getting all of that here and that the information is being widely shared. So I would encourage the board to create such a commission. I would ask that you have a patient chair that board, not an elected official, not a doctor, not a nurse, but a patient. After all, that's what it's all about. And I thank you for your time, your attention, and your interest and concern. Thank you very much.
Thank you, sir. Appreciate you being here this morning.
Next is Dave Stemple. All right, Joseph.
I'm sorry? I don't have anything to say. Okay, thank you, Mr. Simple.
Joseph Hawkins.
Welcome, Mr. Hawkins. Thank you for being here.
Thank you, Mr. Chairman. Excuse me, I'm having a little bit of a throat issue this morning. I'll try to talk so you can hear me.
Yes, sir.
I could stand up here all day and I could talk about my 99-year-old mother who's in a wheelchair, who doesn't have access to her primary doctor now, that we would have to drive possibly hours to get to a doctor that we have not obtained yet. I have 3 people in my family. All of us are over 75 years old. This has come as quite a blow. You've heard all of this. We heard it this morning, so I'm not telling you anything new. So I won't go into all of that. Went to my orthopedic surgeon yesterday. First question I was asked on my piece of paper was, who's your primary doctor? And I went, I don't have one. And I felt so embarrassed, so humiliated that I do not have a primary doctor that I could give them. Prescriptions for all 3 of us. My mother takes extensive prescriptions. Are coming due within the next few weeks with a 0 on it, meaning she's got to have a doctor's approval to get those prescriptions renewed. She has no primary doctor. So that's just part of your situation. We hear about the cost of living, affordable housing, all of that here in Dare County. And that is all very true. We all know it. And it is a problem, but it's not the problem. So I asked myself, we had 4 people in our center up here. 1 retired. It happens. I retired. It's a wonderful feeling. We have 1 that's still there. We have 2 that left. I asked myself why. And the community is asking itself why. I don't have details, but what I'm hearing from everybody, and it is community-wide, is that Vidant came in, escorted Dr. Harrison out, so to speak. We have no reason why. She was loved by all of her patients. She was doing a great and thorough job. And my understanding is she had more patients than the other 3. I don't know that to be a fact. As soon as she left, the other doctor, my primary doctor, who I've known since he was this high, wonderful doctor, wonderful family, saw what was going on with this doctor that had been let go. He questioned, am I going to be next? Could this happen to me? I don't want to be a part of it. He found employment elsewhere. So don't think for one moment that the housing is the problem, though it is a problem, that that's the reason we don't have doctors. The reason we don't have doctors is Vidant's fault. They created this situation. Had they not let this one doctor go and the other one get upset because that doctor went, we would not be in this meeting today. So that's a negative thing I'm saying, and this is a positive meeting. I'm so happy that the 2 commissioner boards are working together and that Vidant is very much getting involved in this. But still remember, they played a very important part in why we're in the situation we're in. Thank you very much.
Thank you, Mr. Hawkins.
Next is Mitchell Bateman.
Welcome, Mr. Was it Bateman?
Bateman.
Bateman, thank
No
you.
kin to Irvin.
I thought that was Irvin's father. No.
Mitchell Bateman, Wanchese. Retired from public education here for 39 years. My family doctor was Johnny Farrow. I've been seen in the clinic up here for 46 years, or ever since it was here. Dr. Halton was before that. I got the letter everybody else got. It's kind of hard to not be negative when, without warning, you lose your family doctor. I had an appointment at that office May the 14th. I'm on some heart medication that requires semi-annual appointments in order to renew the prescriptions. The end of my visit, I stopped by the reception area to make my next 6-month appointment. This was May 14th. Oh, we're not making those anymore. So what? For years, I had a heart event 20 years ago. I've been seen once a year. For years, I could make an appointment a year in advance. Now I can't make one 6 months in advance. They knew long before they sent us a letter that we were going to lose our coverage, we were going to lose our doctors. I learned a lot from the PowerPoint presentation, things I didn't know. I didn't know that it was a law that you couldn't pay doctors but so much money. Now, is that in private practice or is that just in corporate medicine? I think we're a little bit of a victim here of corporate medicine. To back up what Joe said, you know, we didn't seem to have some of these issues until corporate medicine came in. Now, we're not going to be able to abandon corporate medicine. It's here. But let me ask this board a rhetorical question. I worked in public education here for a long time. We had a set state salary schedule. But you know what else we had? You know, because you financed it. A local supplement to make it more viable for teachers to live here, for educators to live here. Is there a law against the local supplement for family practice medicine people? Is that something to be considered? Chairman Woodard, I respect that you are behind the Manteo board, but this is bigger than Manteo. Wanchese is not a part of Manteo. Stumpy Point's not a part of Manteo. Mans Harbor's not a part of Manteo, but a lot of those people rely on Roanoke Island Family Medicine for their primary physician. So we need to look at the bigger picture. I promise you there are probably people in Nags Head who also came over here as well. So I would like for you to consider if a salary compensation package from Vidant can only include a salary to a certain level. Again, a rhetorical question. Is it possible that the local government officials could offer something in addition to make it more attractive? I believe that the top chair in the Board of Education receives a housing supplement, the superintendent's compensation package. Teachers don't get that. Thank you.
Thank you. Appreciate your comments.
That's all that I have signed up. Would anyone else like to speak this morning? Any other public comment this morning? Yes, ma'am.
My name is Amy Phillips. I live here.
Hold on, Miss Phillips. Wait, come on up here to the mic.
Yeah. My name is Amy Phillips, and I live in Manteo. Thank you, commissioners, for this meeting. Thank you, Mr. Sloan and others for being here today. I do appreciate it. This is a personal comment for me. I am 1 year a widow. I just moved back home a year ago. My husband wanted me to be here, and I wanted to come back. I saw on Facebook people talking about the medical practice and no longer being there. So I had to go to the office here in Manteo, the doctor's office, and ask them what was up because I did not get the letter. And I have no assurance that when they start inviting people back in for care that I am going to get another letter. I'm very disappointed and I'm upset. I have medical issues as so many stakeholders here do. And make no mistake, all of us are stakeholders. So I don't know who I talk to make sure that I get a letter. And I am, as Someone else mentioned Dr. Harrison, I understand, was escorted out because she didn't see a certain number of patients a day. Now, that could be just a rumor. I'm not trying to start one. But for whatever reason, we need competent health care and people that care about us, and Dr. Harrison cared greatly. She helped me on a personal level as well as medical, because personal and medical blend together. So that's all I really have to say. I hope that this can be addressed soon. We need to think creatively, think out of the box, and probably spend some additional dollars if we're going to be able to have competent care here in Manteo and the Outer Banks. Thank you.
Thank you, Ms. Phillips. I appreciate you being here.
Yes, ma'am.
Hello, my name's Janine Emery, and I live in Manteo. Thank you for having this meeting. I'd like to thank the Board of Commissioners. I'd like to thank the people from ECU for coming and allowing us to view our concerns. First of all, we moved from near Cleveland, Ohio, so my husband and I, we always had access to the Cleveland Clinic. When we came down here, we ended up at the Family Medicine in Manteo, and we have Chris Handren, who is a PA, which we've never had a PA before, and he's fabulous, so we do love him. So that brings me to, I wanted to say that with the shortage of primary care providers nationwide, have you considered recruiting nurses to act as physician's assistants or nurse practitioners? You know, I understand they have to work under a primary care doctor, but still that would, somebody we would have hands-on, even if they had to work under somebody, telemed, right? That might work. Also, with the shortage of physicians nationwide, competitive offers are required, and you stated that you weren't able to increase salaries. However, I would imagine that some type of contract containing a student loan payment assistance for each year of employment might gain some interest. Difficult situations require innovative solutions. So I know that's something, you know, different, but that might work. And you've already addressed a lot of the other things that I had, that I wanted to speak to, so I'm not going to go into that. But the county and the hospital, as you guys are, need to work together to resolve the healthcare issues facing us today. However, truly, the bottom line is this country is in the throes of a healthcare crisis. And if we don't start voting for leadership that will take action, not just talk about things that they're going to do, but actually institute plans and actions that are going to make changes. Why are we here? Why are we here like this right now? That's really what we need to look at. If we don't start doing this and voting for leadership that will take action and not just talk about it on resolving these issues, it will only get worse. Actually, you get what you vote for, and here we are. Thank you.
Thank you.
Other public comment this morning? Anyone else like to speak? Yes, sir.
Grandstanding.
No, he wanted to leave after I got done, that's all. I'm out of here.
Hi, my name's Chris Roberts. My wife and I have coastal counseling here in Manteo. And one of my major concerns is the role that our primary care doctors have played with mental health treatment and getting medications to clients for uncomplicated mental health issues such as anxiety, depression, ADHD, those kinds of things. We don't have big psychiatric services on the Outer Banks. And now here on Roanoke Island, we've lost those primary care doctors. And that's just one of my major concerns is when those people need their meds, where are they going to go? Thank you.
Thank you.
Thank you, Mr. Roberts.
Other public comment? Yes, ma'am.
Hello, Chairman and Commissioners. Thank you for this opportunity for everybody to get here and listen. Thank you to the ECU Health and the hospital. I just wanted
Your name. so
my
we'll
name
have
is
it
Gay
for-
Morris, and
so
I
we'll
live
have
in
it for the
Manteo.
record. Thank you, Gay.
I was glad to hear that there are plans to expand provision here. But the reality is that this is a justice issue for people in our community who are marginalized, who don't have transportation. If they can get into another practice an hour away, how are they going to get there? And so I've been hearing on the radio ads for OBX Transportation, who say they'll take people around the area in transport, and also they have an out-of-county provision. And I was wondering whether we might look at expanding OBX Transportation with the cost covered by ECU, because this is a situation that has been created not by the patients. And perhaps they could fund people who have to go out of town and actually give them the transportation that they need. Thank you.
Thank you, Ms. Moore.
Thank you so much for having this meeting. It's very informative. My name is Sarah Farrow. I am Johnny Farrow, Dr. Farrow's wife. I might get a little emotional because this is a very emotional time. My husband, thank you, Mr. Hawkins, thank you, Mitchell, had planned to retire a year ago or more. And he did not leave for any other reason other than he had worked for 25 years and basically 7 days a week going in to do paperwork, computer after. He's 63 years old. He has 2 children and myself, and he was just ready to slow down a little bit. Fortunately, an opportunity came available for him to do urgent care, so he could do 3 days. He did not leave Manteo Family Practice in order to go work at urgent care. He was leaving Manteo Family Practice to retire, to slow down. And then he had this opportunity to work at urgent care. He was very saddened and still very sad about what is happening. But that was the only reason my husband left and retired from family practice, to spend more time with his family, and the other opportunity just presented itself. Thank you to this community for putting your faith in him for 25 years. He was born and raised right here, and his roots are deep here. His whole family is from here, and he loves all of you all of his patients, and all of the people that aren't his patients. But this isn't about him, and he didn't leave that practice. They were nothing but good to him, and he was thankful for the opportunity to serve. We both went to East Carolina University, and we're very proud of that. Right. We both started at Pitt County Community Hospital. We've seen the growth, and you all have done great things for our community. And I work at ambulatory medical care with the cancer services, and I'm very thankful for that. And y'all are making a huge difference, so thank you. And thank you for your time, and thank you for explaining what all is going on. It was very informative. Thank you. Now, if we'll just all continue to work together, because it's about the whole community. So let's just keep plowing ahead, put our differences aside, and keep lifting each other up. Thank you.
Thank you, Ms. Farrow.
Other public comment this morning? Anyone else like to speak at public comment? Yes, sir.
Welcome, Malcolm.
Welcome, Commissioners. And I want to thank you, too. You all are important members of our community. And I know how each and every one of you care. And I know I'm excited at the rapid rate that you are addressing this issue. I want to thank Bobby Owens, his commissioner, Melissa. I've told her it's tough to have a wand cheeser come to Manteo and help fix us. But she's providing good leadership for our town.
it has been said over and over from those in the know, we're in a crisis. Okay. You've addressed that. Tess has addressed that. Ronnie's addressed it. The town has. We are in a crisis. But we've been there before. Our county has. I was told today we don't have a control group. I didn't know that. It's changed. But that is some of the best work that I've ever seen in our county, when you have different bureaucratic agencies come together to solve people's problems. And they do it masterfully. And that's what we're asking now, is for people to come together. And I'm optimistic that that will occur because I know this community. I was asked at a meeting, why should I be involved? And I wrestled all night long about that because I don't have any credentials, don't have any education. But what I do have is a knowledge of the community. And I have a love and care for my community. And this issue is not my issue. This issue is my mother's issue, who is over 55 years old and is in the back. And many other people like my mother that don't have their son living next to them that can help them, just like Joe said. They don't know where to go. They don't know where to turn. To say that that practice is not closed might be technically true, even though Dr. Fair's name is still on the door today and Dr. Harrison's name is still on that door today, who don't even practice there. That practice is closed to the thousands of people that attended that practice. It is not Roanoke Island's issue. It is Dare County's issue, because you cannot leave the Vidant system, which I was a part of, and go to another Vidant provider in our county because they have no capacity. Ronnie Sloan said, the hospital will help outside providers set up. I'm going to challenge you today, Ronnie, my friend Ronnie, and my friend Tess, who deeply care about our community, to do that. Recruitment is the issue within that organization. I've been in this issue 10 days. Before I left the Manteo meeting, I had 3 doctors want to meet, and they have met with public officials and say, we want to open up practices here on Roanoke Island. You don't have to provide them housing. You don't have to recruit them. They're here. There are other doctors within this community that want to open up practices. They're here. You don't have to send them a postcard. They're in our community. So I would encourage us as a community to solve our community issues. There are many people in our community, throughout the Dare County community, that want to help you. Y'all have a lot on your plate. I know this issue is probably touching Danny and Hatteras because he is without adequate medical care down there. So the people that I have talked to, and trust me, I've had my phone in the ear from 4:30 in the morning till I go to bed at 8 at night. This community needs your help, and I know you will provide that help, and there are many people that are willing to help you with that. Thank you.
Malcolm, now I finally understand why you text me at 5:30. After all these years, my phone's, and I get up early too, but he goes to bed at 8 o'clock. No wonder he can text me.
Don't give me your phone number and let me know you wake up early, because I'll call you.
Is there other public comment this morning? Anyone else like to speak at public comment? Yes, sir.
Dr. Holton, thank you for being here.
Thank you. Walter Holton, and I have a little bit of knowledge about the history of medicine here. I practiced for 44 years. I actually stopped practice because of a minor injury that affected my ability to use computers. And I often believe that when they changed the person-to-person way of handling medicine and went to medical computers that almost dominate the time, medicine changed a little bit. It made it much more difficult for the providers. You know, I don't have the answer to the problem. I recruited for all those years. I started alone. There was no other physician here except one that came with me when I left my residency and came here in 1974. And we started recruiting. Recruiting does take a community. You know, people go to communities to practice medicine because they think their family will be happy there, that they'll be supported by the community, because it is a hard job. I'm talking about Dr. Farah, and he and I used to meet in the office on Saturdays and Sundays. And as far as what you can pay a physician, well, they put in a total, actually, of generally nearly 11 years of training. They have to have a college degree. They have to go through 4 years of medical school and generally 3 years of residency. And that's a lot of time. And medicine didn't used to cost what it does today to go to medical school. And they all leave with owing a lot of money generally. So, you know, and people think physicians, oh, they make a huge amount of money. Well, there are some specialties I wish I'd gone to. But in family medicine, there's kind of a baseline. But, you know, there are ways that you could help, I think, in recruiting. And I just think this meeting makes me feel better about things. I support the people that have worked through that hospital. Mr. Sloan, he's excellent, I think. Lynn Miles, she is a good person, and she did what she had to do in that letter. And I think it's now time, though, to pull together as a community and just find ways that we can make this a place where physicians want to come. And little things will make a difference. So I just thank you for having this meeting, because it sounds like we're a community that's trying to solve a community issue. And so I thank you.
Thank you, Dr. Holton.
Other public comment? Anyone else like to speak this morning? I don't see any other hands, and with that, Mr. Chairman, we close the public comment.
Okay, thank you, County Manager. That brings us to item 5, and that's Commissioner's comments. Before I move into that, though, I would, Ronnie, could you address the prescription issue, that conversation you and I had about the 30-day bit? Would you be kind enough to explain that?
Sure, I'd be happy to. North Carolina Medical Board, in our 30-day period, is those temporary providers, obviously, once they leave, they can no longer be your provider, right? So they no longer can refill your script because they're now gone out of the area. And when you're in a practice, you're not the practice's patient. You actually are the patient of that specific physician or advanced practice provider. When you take a look at refills in medicine today, there's multiple types of medicine, right? Some, let's say blood pressure medicine, which is a great example, can be refilled once a year, and you've got a year refill waiting on you. Some may be 6 months. Some medications that are more complex may require that you see patients every month or every couple of months. You can't do but limited refills because of the type of medication it is. But I mentioned in the presentation at the hospital last week, that is those very high complex patients that we have a group of members from ECU Health who are assisting those folks with those type of refills, getting on exactly the kind of medication the gentleman reached up and talked about a little earlier in those type of medications for folks. So it's varied, it's still complex like most things are in healthcare, but that's it. Does that answer your question, Mr. Chairman?
Yes, sir, it does. I hope that helps those out there that's listening I wanted that to be clear.
Could I just follow up on that?
Yes, sir, Commissioner Ross.
Just real quick, Ronnie, in as simplest terms I can frame it. If a patient needs a prescription now, will they be left in the cold, in the dark, or is there a path they can get that prescription filled?
There are several paths, as I mentioned in the presentation as well. We have a virtual platform called Vidant Now that also can refill medications on a limited basis. We also have our Center for Healthy Living, who we know that the county employees utilize, as well as the town of Nags Head. They're also helping refill some prescriptions. And our urgent care centers, which generally are not in the business of doing refill medication, they're more episodic in nature for care, cut your finger, that kind of stuff, also are helping assisting medication refills. And then you have the number, all of those patients have the number to call. I would encourage to call if you're getting ready to run of your script, and we will do our best to figure out how to help you get your refill until you can find care elsewhere.
Good.
Ronnie, and a follow-up to that, in a lot of cases, when a prescription has run out and you go up there to get it to the pharmacist would call down at Manteo Family Medicine down here and get the okay to refill it. Again, I think they were basic blood pressure, type stuff, maybe a statin or something like that. Never was an issue getting that. So can they do that now?
If that last provider that filled the refill the last time is gone and no longer there, then another provider hasn't established care with that patient yet, so they would have to reach out to one of the other avenues that I mentioned earlier.
Okay, like the Vidant Now
Yep.
deal. Okay, thank you.
Ronnie, thank you for doing that. I appreciate you clarifying that. Once again, we're back at item 5, and I'm going to call on my fellow commissioners. But before I do that, each one of us have been working diligently over the last several weeks in our own different ways. I've been working with the Chairman Judge and President Sloan and members of the community, as well as my fellow commissioners have met with several doctors. One of my fellow commissioners has met with some competition with respect to Centura. So we're all out there individually looking for avenues and ways to contribute to resolving these issues in Dare County. So I wanted to make that very, very clear that our board is engaged, and each and every one of our commissioners have been engaged ever since that initial letter was sent. So we're trying to tackle this daily, and we get all kinds of phone calls, and we pick up bits and pieces here, but we're going to work hard to work together. And this morning so far has been a really, really great meeting. I cannot thank you for your patience, your honesty, your commitment to wanting to assist us in any way you can to remedy this situation. So that's how we can accomplish things. And I can't thank you enough for the way you've handled yourself this morning in this meeting. With that being said, Commissioner Couch, do you mind kicking it off?
No, thank you. Being a resident down in Hatters, I've known all along out of the probably 7 primary care physicians, we've got 3 down there, and I didn't want to tip anybody off on that because we don't want to lose them. But they're very good. They're really, really entrenched in the community. They go to our churches. They're raising families. They're loyal to their employer in all those good ways. And I want to work with ECU Health, and just give me a second here. They saved my life. My PSA counts were double digits. I was told by Outer Banks Center for Healthy Living on 3 different occasions, you got to look into this. I went to urology practice nearby across the state line and wasn't happy. But then here come the pandemic. We had to close the bridges for 6 weeks. They told us we're going to lose 10% of our population. We were prepared to lose 10% of our population, and we did what we had to do. So I neglected my own health care. And, but I got back into Outer Banks Urology over there. Every interaction I've had with the healthcare professionals over there has been good. You know, I understand your concerns and I hear what you're saying and I'm sympathetic. My experience is going to be on a positive side, not that yours isn't. I perfectly understand what you go through here on Roanoke Island. If you live in Dare County, it's a long drive anywhere, and it's coming from a guy in Hatters, where McDonald's is 44 miles away. But, you know, ECU Health, it's become a teaching hospital now. Those are the ones that folks want. ECU Health, they are responding to public demand on this. And my point to that is that they and we, us, are in a position with the resources that we have to rectify what's going on here. This can be done. Now, there's a couple of things that I heard in public comment that I don't want to say they concern me. I want to point some things out. Yes, it's a corporate model, and ECU Health's profits went 31% over 31% over a 12-month period as far as providing, looking to the Dare County and your local taxes to provide housing. That's going to be a secondary responsibility of ours. I don't know how quick I can get behind something like that because I think it should be on the onus. The onus should be on our health professionals to provide care for their people. Other people provide care, or excuse me, provide housing and fundamental accommodations for their people. So, I mean, I'm listening. It's not a hard and fast no, but I'm a little concerned about that. Also with Mitchell, he's down in Hatters. He helped us a lot. I spent 12 years down there in that school system. Almost took a couple of grades twice. I've known him for years. But, you know, a supplement from the county also for that. Again, it's not a hard and fast no, but I'm a little leery about some of the things that I'm hearing here. I did want to latch on. One of the good speakers had something to say about we have a citizens committee to be led by a patient. I don't know about that. But, you know, that's what the Outer Banks Hospital Board is for. And, I mean, there's nobody more connected in this community than the chairperson of that board. You can call that board at any time. They will drop what they're doing to get back to you. And so you already have that advocacy group, in my way of seeing it, already. So, you know, set up a committee to do something that's already being done by a high-performing board is, I don't know if that's going to be an answer as well. I thank ECU Health for what they're doing. I'm a product of East Carolina. I went there to meet girls and drink beer and did a lot of that, but they made me get an education. And we are in capable hands. We can work with them. They're not shoving off the lifeboat with an improper amount of life preservers in there. We're going to do this together. We're going to get this done. So be patient with us. I know everybody on the Manteo board. Dr. Holton, thank you for your service. My mother drove 44 miles to see you and wouldn't go anywhere else. And she died in '91. So thank you for your service. Thank you, Mr. Chairman.
Thank you, Commissioner Couch. Points well taken. Commissioner Bateman?
Sir, first of all, if I upset anybody, I'm sorry. I am who I am. What you see is what you get. The local hospital, I will just tell you this, you guys do a great service to the community. You know, I have friends serve on the board. Ronnie Sloan, you're doing an outstanding job. You care about the community. You supply a service to us that we did not always have. In 1966, my grandfather had a heart attack in Kitty Hawk. Grandmother threw him in the back of a car, drove to Dr. Wright's in Curry Tuck. He stabilized him the best he could. They called for an ambulance, took him to Elizabeth City. That was over an hour and a half after the heart attack. Then they took him to Norfolk Portsmouth Naval Hospital. 6 hours later, he was there. Now you can be in Outer Banks Hospital in no time, and you can have a med flight would take you to Norfolk for the heart catheterization, or to Greenville for any kind of head trauma or neurological problem, and you're taken care of. Things have changed, and we're much better off now because of the service that you guys have provided to our community. When you walk into the hospital, there's a thing that says Outer Banks deserves compassionate and coordinated care close to home. That was put up there probably 11 or 12 years ago, and they still, I believe, believe in that slogan that's there. Because of the corporate model that's enacted by hospitals all over the United States, everywhere, I think we've gravitated now, so the hospital is still there doing that, but it doesn't necessarily gravitate to the Dare County personal residence model, which is we need personal care. And now we've got 2,400 to 3,000 people who can't have that. So the panel doesn't fit the residents. Dare County is a leader in a lot of stuff. We're a leader in beach nourishment. We're a leader, and we're doing great things for trying to change the opioid problem. We've enacted recovery courts, all kinds of things to make Dare County better. We can be a leader in healthcare. And I think Malcolm and Todd Grisol said this, why can't we have Dare County to be the leader in physician care for our people? Why can't we take a model that's put together by physicians that can service 8 to 12 people a day with community involvement, with involvement from Vidant, so those patients can get that service? We can have 6 or 8 doctors that Malcolm talked about. Be open-minded about this and be able to service these people the way they need to be serviced. That would help and make the physicians happy. You know, physician under the gun, as Dr. Holton said, it took the fun out of it because of the fact he's doing paperwork, and Johnny Farrow doing paperwork all weekend long because of the corporate structure and the corporate greed out there. You have to do it because you have to make money. We understand this. But once again, just like in the restaurant business, the customer is the right, and the customer is the #1 person. That's who we need to take care of, Dare County. And so I think we, as commissioners, as leaders, as well as you as residents, we can come together and form some kind of model so we can go forward and do this correctly and together with a physician model that's based on the needs of the residents. It's a difficult situation. It's very emotional. Like I said, I am who I am. I'm not taking anything away from the job you guys do. You know, I know a lot of y'all personally, but this is bad. You know, when someone has to drive an hour away and the mother's in a wheelchair, 99 years old, to get a physician, that's not right, and it wasn't handled right. So I look forward to the board, as well as the community together working with Manteo, for us to have a active dialogue that's productive, and I want to see results. And I'd also like to have an answer about the gentleman asked, I believe, about his physician. Who gets priority when you do get physicians there? Who gets priority? Can these people who lost their doctors come back and have #1 priority to be back in line again? I'd like to have an answer to that at some time. Thank you.
Thank you.
Thank you, Commissioner Bateman. Appreciate those comments. Vice Chairman.
Thank you, Mr. Chairman. Just want to say thank you to the representatives of Vidant Medical Group for attending today and for reversing their original decision not to attend. This is much too important a discussion for you to not be here. So again, thank you for attending. To listen to the members of our community affected by the decision to remove patients from your roles in the Manteo office. My wife and I both received the letter. She, being a pancreatic cancer survivor, is obviously and understandably very sensitive to not having local primary medical care available. Myself, I'm just old and need the occasional visit for a physical and sometimes cold. This is a medical service crisis in Dare County. It needs to be treated as such by Vidant and Outer Banks Hospital. It is your responsibility to provide the primary care required for our community, and it needs to be in a crisis mode. The normal way of doing business is not correcting this issue in a crisis manner. The Dare County Board of Commissioners and others view this as an all-hands-on-deck situation and are going to exhaust every possibility to get more primary care for Dare County in general and Roanoke Island in particular. We will partner with all concerned in this effort. You mentioned fair market value as part of being able to remunerate or pay your doctors. Who determines fair market value? Who has to request that this be reevaluated? It is obviously different in Raleigh and Greenville versus Dare County. We're in crisis. You can find a doctor on every corner in Raleigh, probably in Greenville, but certainly not here. With our crisis here, I would be surprised if a reval of the fair market value would not result in an increased rate. So I would like that question answered. Mayor Owens mentioned that Ronnie has bosses that control what he can do, and I truly believe that. We have bosses too, and they're the people of Dare County. This is why we are involved in this issue and working in any way possible to relieve the situation. Again, this is a crisis. We all need to act like it. The corporate model makes one think a pencil pusher in Greenville is running things and not the doctors. Thank you.
Thank you, Vice Chairman. I appreciate it. Commissioner House.
Thank you, Mr. Chairman. First off, I do want to say I myself have a bit of experience in healthcare in Dare County for quite a while. I was a paramedic for quite a few years. And our EMS system here in Dare County is second to none. It is known not only across the state, but also recognized nationally. And Dr. Holton, a big part of that is from you. And thank you for your service. I did reach out, and because like I said, this is a crisis. In a crisis, you want to look under every stone and every rock and try to find a solution or something that will help. I reached out to Centera, and they let me know that when that letter went out, their call center exploded. Their phones are ringing off the hook. So they are well aware of the situation here in Dare County, and they want to continue talks with us, with the chairman, the vice chairman, myself, and the county manager, to have a sit-down discussion with them about the situation. And I assure them that we could probably make that happen fairly shortly. They did want me to read a statement that they issued. So we appreciate the community's interest in expanding Centera services in the Outer Banks. Please know, we are having conversations about the needs of the Outer Banks community, but we firmly believe that the future plans must be sustainable. In the interim, we do have some resources for the Outer Banks neighbors, including Centera Family and Internal Health Medical Physicians in Moyock, the Centera Family and Internal Medicine in Edenton, and also through virtual visits at CenteraVideoVisits.com. And also, if you need any further assistance, you can please, they ask you please to visit Centera.com/Albemarle. And the discussions I've had with them have been with the Holly Burke, who is the Regional Director of Business Operations for Centera Ambulatory Division. And like I said, they were very favorable to it. And I was actually put in contact with her after I contacted Phil Jackson's office at Centera Albemarle. He's the president of Albemarle Medical Center. So we hopefully will future have those discussions and possibly see if we can expand their services down here on the Outer Banks. So with that, I'll conclude by saying I too am critical of the way basically this thing was handled. And there should be more open discussion with our community and let them know what's going on, other than trying to find out bits and pieces of information as it goes on. Other than that, thank you for your time.
Thank you, Commissioner House. Commissioner Ross.
Thanks, Mr. Chairman.
Last but not least.
Yes, indeed. Thank you. I was struck as I was listening to all of this unfold, and if you'll give me just a bit of your patience on this.
Take your time, Commissioner.
The parallels were surprisingly similar to me because recently, although ours, albeit on a local scale, I'm looking at you guys. Thanks for being here, by the way, all of you from the hospital and ECU Health. On a national scale, if you've been paying attention, you saw a story not long ago where a very large government agency in that case elected to close a facility that provided an essential service. That facility had a large and dominant market share in that essential service, and that closure was done with, frankly, very little fanfare, and afterwards, during a predictable outcry, very little advanced planning or anticipation. I'm referring, of course, to baby formula. A baby formula plant was shut down at Abbott. 40% of the supply was terminated, and to the surprise of absolutely no one, 90 days later, shelves were empty, mothers were frantic, communities were up in arms, airplanes were being sent to Europe to airmail in baby formula, and it was a huge, geez, couldn't you see that coming? Okay, I understand that's a different situation on a national scale, but if you, again, bear with me, the similarities are we have a very large provider on our scale called the Manteo Health Clinic. We have a very dominant market share as represented by the 2,400 plus patients who were notified services will no longer be provided. And predictably, within days or weeks thereafter, you have the same outcry of, gosh, guys, how can this be possible? How can you close that facility, send out a letter, and let people know? And again, similar to the Centera letter, there are services 60 miles away in Moyock or Edenton or Elizabeth City or Plymouth, all of which are substantial hardships for, and I know one of the speakers represented a 95-year-old parent, that would present an enormous hardship going 60 miles one way to see a primary care doctor. So I feel bad because it's like I'm looking in the mirror with 20/20 hindsight. That situation was predictable, visible. We saw it coming. And I now see us in a similar position. And again, thank you guys for being here. My question to you now would be, A, 3 full-time primary care physicians, Drs. Farrow, Harrison, and Blackburn, all departed the Manteo Clinic, if I'm correct, in a very short period of time. Also, if I understand correctly, we had 3 temporary physicians all choose not to renew their contracts in a very short period of time. And we are now in a mode of aggressive recruiting and housing issues, preventing or slowing down some of that recruiting. My question to you, and not necessarily answer now, of course, are there underlying issues or conditions that are being looked at And again, Mr. Sloan, Mr. Briley, Ms. Judge, the underlying conditions that will be or are being addressed so that June 2023, the Dare County Board of Commissioners has called a special meeting to address the departure of 2 recent primary care physicians and the closure of fill in the blank which clinic. I understand globally, nationally, shortage of healthcare professionals. I don't, by the way, Ronnie, I don't know the details of the Stark Law. I'm sure you guys do. It's part of what you do every day, so I don't question you there. What I would simply throw out is, are there creative ways to address it or get around it if that is indeed a barrier? And again, the underlying cause, whether it be housing, I'm retiring because I know Dr. Farrow, as Ms. Farrow shared with us, did retire but is providing health care on 3 days basis at an urgent care facility. I don't know if Doctors Blackburn and Farrow are also still in the community. I don't know them, but I'm just wondering if they are still out there as well, providing health care in some different format. I would challenge ECU Health to look at those primary, fundamental, underlying issues that brought us to this point, and perhaps from that take a learning experience of, geez, if we control a huge chunk of something and we're about to turn it off, there would be a predictable response. Because again, you know, we're talking about, I think someone earlier said, a very personal issue, as in healthcare. Many of our citizens, residents, are over the age of 65, some into their 80s and 90s. It becomes vital. I mean, it is as vital as every day. In their issues list, it is number one every day. So I'm going to conclude my comments by just saying I saw that on the national level with the formula and thought, gosh, how could they not have foreseen the predictable outcome of the action? Well, I guess it can happen. I'm asking you to consider, let's not let it happen again. And 2, let's investigate and address the underlying conditions so that we don't return here a year from now and have a similar public meeting. Thank you, Mr. Chairman.
Thank you, Commissioner Ross. I will certainly, County Manager, you have anything you'd like to add?
I'll just add 2 things. One is, we've been, just to add to what we've been doing, we've been in touch with our lobbying group in Raleigh as well when this first broke. I think Commissioner Overman and Commissioner Tobin and I were up there anyway, and we have talked to them, and they've reached out to the North Carolina Community Health Center Association to help sort of facilitate, give us ideas and thoughts in recruitment. And we've also been in contact with the CEO for the North Carolina Academy of Family Physicians. And again, the idea was to get ideas where they could help us, where they could guide us and do that. And they've been helpful too. So as we put these things together, there's 2 other resources that we've reached out to in an effort to move forward with trying to recruit physicians to the area.
Thank you, County Manager. Is that it? Okay. Anyone else? I'll give anyone else out there an opportunity if they'd like to ask a question or anything. Yes, ma'am.
I just wanted to let all the community know that's here today. I contracted with a nurse practitioner locally in order to get my prescriptions. I paid up front for 3 months, or 6 months, I think, and I can renew it for another 6 months, but it's a maximum of 1 year through her. And unless you have pain medications or certain psychiatric medications, she will contract with you and she will refill your prescriptions. So I'm just throwing that out there. And then the last thing is the 5 Ps, and I don't say this to be humorous. Proper preparation prevents poor performance. Thank you.
Thank you, and I appreciate you sharing that information with us. Hopefully, there's several people out there. Yes, ma'am. Do you have something you'd like to say? No, come forward. Come forward. State your name.
My name is Dr. Jennifer Harrison, and I'd just like to let President Sloan know, as well as Mr. Briley, Ms. Judge, that I am available to talk with you about, if I have any inside knowledge or ways that we can work on underlying issues in order to help this community be successful. So thank you all for what you do. Thank you.
Thank you, Doctor.
Thank you.
All right.
I have something.
Yes, ma'am.
I'm back. Okay, I need to qualify what I said about voting. I wasn't referring to you guys. I think you guys are doing a great job, and it's wonderful that you guys are all working together, and I can see that you're moving forward, and I know that good things are going to happen. I'm talking about at the federal and the state level where we need to vote for people that are going to make these changes. Okay, we're talking about college tuition. How much do you think that these primary doctors come out owing when they get out of school? You guys know the numbers, right? We can't sustain that. It's unsustainable in this country. Okay, now you guys can help though, pay some of that money so that they can, you know what I mean, to offset that. When you talk about creative and being, supplements, like you were saying, no, we should not be responsible for supplementing their housing, especially if they're at 30% increase over the last year, right? So things like that. But anyways, I just wanted to qualify the vote thing. Thanks.
Thank you.
Can I make a motion that we capture her remarks favorable to the board so that we can put that, that makes a list of one.
Well, once again, thank you all for being here. I'm hopeful that you found this meeting a productive meeting, an informative meeting, and certainly a meeting that you can share with your fellow citizens that the Dare County Board of Commissioners, along with the Manteo Board of Commissioners, are committed to see what we can do to attract physicians to the area. I had item 6 as a plan of action, but I'd like to take all of this information that we've heard from you folks today, because it's and I've got tons of notes. Every single one of y'all, I wrote every word that you spoke about. And I will I will be in touch with my fellow commissioners one-on-one, and we will brainstorm how we move forward from here. We will certainly make you fully aware of that. We'll get it on our webpage so that you have an opportunity to look at our website as to how we're trying to tackle with this. And as the representatives from the hospital, Chairman Judge and President Sloan, and certainly President of ECU Community Health Hospitals, Mr. Briley, we will continue that dialogue. Y'all have been extremely access is just, Ronnie, you and I, you probably talked to me more than you really wanted to in the last couple of weeks. Tess, a little bit different. We haven't had quite as much, but I know that we've had some great conversation. And President Briley, I'm sure that I can reach out to you and you'll be available. So we're going to continue this dialogue. We're going to see what we can do to do what we can to attract physicians in our area. We got a hell of a story to tell, folks. God, what an unbelievable community we live in, and who in the world wouldn't want to live on the Outer Banks? I mean, this is God's country. I mean, this is why that's why the Wright boys flew off that hill down there. So, thank you all for being here, and God bless each and every one of you.
Mr. Chairman, before you adjourn,
Pardon?
I have a motion.
Yeah. We have, county manager has a motion to go into closed session.
Yeah, we need a motion pursuant to 143 through 1811-3 to go into closed session to preserve the attorney-client privilege.
So moved.
Motion on the floor by Commissioner House, been seconded by Commissioner Davies. Those in favor, signify by saying aye.
Aye.
Motion carries. I call the Dare County Board of Commissioners meeting back to order.
In the closed session, the board gave guidance to the county attorney and took no other action.
All right, thank you, County Manager. That brings us to the close of the meeting, and I need a motion to adjourn until 5 p.m. on July the 18th.
So moved.
Motion by Commissioner House, seconded by
Me.
Commissioner Bailey.
Commissioner Bailey.
Those in favor of the motion signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.